My name is Laura Faeth, and I'm a first-year nursing student at Cal State San Marcos. I've always had a natural inclination to help and serve others, as well as a love of learning, which has inspired me to become a nurse and also pursue this Pathmaker internship. The main reason why I would want to be a Pathmaker intern is to gain direct insight into patient care as well as hands-on experience in the medical environment. I've already had some experience with patient support and assisting nurses and CNAs, as I'm a volunteer on a med-surg unit at Scripps Memorial Hospital in Encinitas. Through this role, I've learned that you don't have to have a professional license to be a successful and caring medical provider. All you have to have is a selfless heart and a desire to make people feel better. Whether it's by restocking rooms so that nurses have more accessible supplies, sitting with patients to talk about their day, or attending to a patient's basic needs, being a volunteer is such a selfless way to serve the medical community, and I hope to apply the experiences that I've had there to the Pathmaker internship. I believe that being an intern would give me a more nursing-based approach to patient care rather than a volunteer-based one. It would allow me to work more directly alongside nurses rather than in the background and become familiar with the jobs of different healthcare providers through observation and hands-on experience. So, my first goal in being a Pathmaker intern is to network with nurses and other medical professionals, something that I haven't really been able to do yet as a volunteer or in any other aspect of my life. I would love to hear about others' career paths in the medical field and the specific experiences which shaped them as a medical provider. Every shift, I want to take home one piece of evidence from a nurse or CNA or a doctor, as every story and conversation will shape my view of the medical field and build my own path. My second goal as a Pathmaker intern would be to work in at least 5 departments over the 240-hour commitment. I want to have a diverse and well-rounded view of bedside care. I believe that if I were to see how nurses treated patients in different areas of the hospital, it would give me a more holistic view of medicine as a whole. This would also help me apply my observations to clinical rotations later in school and know how to care for patients in different aspects of the hospital, from the birth center to the trauma ICU. Thirdly, I would want to make a positive impact on one patient, one family, and one medical provider per shift. Whether it's by attending to a patient's dietary needs, chatting with family members after a rough day, or stepping up to help a nurse and CNA with any task, I would make an effort to brighten someone's day and make a shift a little easier for someone else. As a hospital volunteer, patients and their families have described me as a ray of sunshine, since I'm always smiling and looking for new ways to help. I believe that selflessly showing that you care and going above and beyond to every patient is crucial in becoming a great provider, whether you're a volunteer, an intern, or a nurse, or even more. These are the experiences and goals that I bring to the Pathmaker program, and I'm confident that I can provide the hospital staff and patients with service, responsibility, and comfort. Thank you for your consideration, and I look forward to hearing from you soon.